It's usually easy to tell the difference between the voice of a young adult and an older one. Raspy, cracking old voices can present a number of problems, however, from underlying health issues to hindered social interaction. Dr. Stephen Feinberg of Hoag Memorial Hospital Presbyterian in Newport Beach talks about how old voices can be made young again.
People usually accept some degree of change in their voice with aging, but when their voice starts to limit their social interactions, when they can't be heard in public, or when their spouse, who often has hearing loss in the elderly population, has trouble hearing them, then they often present for help.
We ask, what are the most common problems with an aging voice?
There's a number of voice problems that affect people. Those can include anything from neurologic disorders affecting the voice, benign or cancerous lesions on the vocal cord, functional disorders of misuse of the voice. And when we talk about the aging population, we see those same problems in the elderly, but we also see other changes. In the elderly, there's a number of structural and physiologic changes in the way that the larynx works. The cartilages become calcified and more like bone in the elderly patient, and the vocal cords change in their structure. They can either become more atrophic, usually in men, or in women they can become thicker, and that affects the way that the vocal cords vibrate. So in the elderly, the most common voice problems are really the same as those in the younger population, but there's a whole host of other problems that are more commonly affecting the elderly, like neurologic disorders, for instance, Parkinson's disease or stroke, and in addition, atrophy and insufficiency of the vocal cords related to loss of tissue with aging.
Dr. Feinberg spelled out the treatment options.
Given the wide range of voice disorders in the elderly, the treatment varies wildly. The most common diagnosis in the elderly population is a vocal cord polyp to cause hoarseness, and that's the same as in a younger population. And so that's a surgical management. For those patients that have atrophy of the vocal cords and vocal cord insufficiency, which is what we often think of when we talk about the quote-unquote aging voice, those treatment options can involve maneuvers to try and manipulate the bulk of the vocal cords, and so we can inject substances into the vocal cords to bulk them up and to rejuvenate the voice.
And just how common are aging voice problems?
It is fairly common. These problems are very prevalent in the older population, and we don't see a specific age at which they occur, but they occur across a spectrum of ages, but usually over the age of 75, where we start to see the atrophy and bowing of the vocal cords. And these are treated very often with good results. And there are changes from childhood onward into adolescence and then into adulthood in the voice. And so we have changes in the structure of our throat and of our resonance tract, which is our face and our sinuses. And those things do change during the aging process. But at a certain point, the changes start to become pathologic, where the voice becomes difficult to hear or where it becomes tremulous. And those things are treatable, and so we like to make an accurate diagnosis and proceed accordingly.